Hello everyone. Before we start, make sure to like and subscribe to the channel and leave a comment with where you're from and what time you're watching. That way, YouTube will keep showing you stories just like this one. Now, let's begin. As a neurosurgeon, I've performed thousands of brain operations, but when I had to operate on myself to survive, voices I'd never heard before talked me through every incision. The surgery was perfect. I have no memory of how I did it. My name is Dr. Rachel Torres, and what I'm about to tell you will sound impossible, but I have the surgical footage, the medical records, and the scars to prove every word is true. This is the story of how unknown voices saved my life by guiding me through the most complex brain surgery I've ever performed, on my own skull, while I was fully conscious and bleeding to death. Mount Sinai Medical Center, New York City, November 15, 2024. 8:23 in the morning. I was 3 hours into removing an arteriovenous malformation from a patient's brain when something inside my own skull exploded. The pain was so intense that I dropped my surgical instruments and staggered backward from the operating table, blood streaming from my nose onto my sterile gown. "Torres is down," my surgical nurse shouted as I collapsed against the wall of operating room 7, my left side going numb and my vision turning white at the edges. I knew immediately what was happening. After 18 years as a neurosurgeon, I could diagnose my own condition even while experiencing it. Subarachnoid hemorrhage, a massive bleed in the space surrounding my brain. Without immediate surgery, I had maybe 20 minutes before permanent brain damage, maybe 40 before death. But here's where my story becomes impossible to explain. As my colleague Dr. Henderson rushed me toward the emergency cord scanner, my consciousness didn't fade the way it should have during a stroke. Instead, it became sharper, clearer, more focused than it had ever been in my life. I could see everything in the hospital corridor with supernatural clarity. I could hear conversations happening 3 rooms away. And most disturbing of all, I could sense the exact location and severity of the bleeding in my brain with perfect accuracy. "Anterior communicating artery," I told Dr. Henderson as they wheeled me through the halls. 7mm and there is a rupture, bleeding into the subarachnoid space and creating pressure on my left frontal lobe. "I have 18 minutes before irreversible damage." Dr. Henderson stared at me in shock. No patient should be able to self-diagnose a brain hemorrhage with that level of detail, especially while actively having a stroke. But when the emergency cord scan came back 15 minutes later, my diagnosis was correct down to the millimeter. "We need to get you into surgery immediately," Dr. Henderson said, studying my brain scans with growing concern. "This is one of the most complex aneurysm locations we deal with. I'll perform the operation myself." That's when I said something that no neurosurgeon should ever say, something that went against every protocol and principle of medical practice. "I need to operate on myself." The words came out of my mouth with absolute certainty, though I had no idea where that certainty came from. Every rational part of my medical training screamed that what I was suggesting was impossible. You can't perform brain surgery on yourself. The positioning alone makes it physically impossible. The psychological stress would be overwhelming, and operating while having an active stroke should have been instantly fatal. But I knew, with the knowledge that seemed to come from somewhere outside my own mind, that I was the only person who could save my life. "Rachel, you're having a stroke," Dr. Henderson said, her voice tight with concern. "You can't possibly perform surgery on yourself. You need immediate medical intervention from someone who isn't actively bleeding into their brain. If anyone else operates on me, I'll die," I replied, my speech surprisingly clear despite the obvious neurological symptoms I was experiencing. "I can see the surgical path that needs to be taken. I can feel exactly where every blood vessel is located. I know what needs to be done, and I'm the only one who can do it." I can't explain why Dr. Henderson agreed to my impossible request. Maybe she realized that my condition was deteriorating too rapidly for conventional approaches. Maybe she recognized something in my voice that convinced her I knew what I was talking about. Or maybe she was just desperate enough to try anything to save my life. They set up operating room 12 with a special configuration of mirrors and camera systems that would allow me to see my own brain while working on it. Local anesthesia was injected into my scalp to numb the surgical site, but I remained fully conscious throughout the procedure. This was necessary because I needed to maintain my cognitive function to guide the surgery. but it also meant I would experience every moment of operating on my own brain. As I made the first incision into my scalp with a trembling hand, something extraordinary happened. I began to hear voices, not hallucinations or psychotic episodes, but clear, distinct voices that seemed to be coming from somewhere just outside my physical hearing. Start the craniotomy 2.7 centimeters lateral to the midline, a deep male voice instructed, his words precise and authoritative. The bone is thicker in that area and you will need to adjust your drilling speed. I had never heard this voice before, but his knowledge of neurosurgical technique was flawless. I followed his guidance and found that the bone thickness was exactly as he had predicted. The drilling proceeded smoothly, creating a perfect circular opening in my skull. Now you need to identify the ruptured aneurysm, a woman's voice added, her tone clinical but somehow comforting. It's located 4.2 millimeters from the surface, angled 15 degrees toward the anterior aspect of the communicating artery. As I worked deeper into my brain tissue, more voices joined the conversation. They spoke over each other sometimes, providing overlapping guidance about surgical technique, anatomical landmarks, and the specific characteristics of my hemorrhage. But their instructions never contradicted each other, and every piece of guidance proved to be absolutely accurate. Use the micro scissors for the next dissection, a younger male voice directed. The tissue plane is more delicate than it appears. Apply pressure for exactly 4 seconds, then release. The most unsettling aspect was that I found myself performing surgical techniques that I had never learned. My hands were executing maneuvers that exceeded my training and experience, guided by knowledge that seemed to be downloaded directly into my motor control. I was using instruments in ways I had never seen before, approaching the hemorrhage from angles that weren't described in any surgical textbook. You're going to encounter unexpected bleeding when you retract the frontal lobe, the deep male voice warned. Have the bipolar cautery ready and apply it to the vessel that's 2.1 millimeters to your right. The bleeding occurred exactly as predicted, at exactly the location he had specified. The recommended treatment controlled it perfectly, allowing me to continue the surgery without complications. This pattern repeated throughout the operation. The voices would predict problems before they manifested, provide solutions to challenges before they became critical, and guide me through techniques that seemed to exceed human surgical capabilities. As I worked to clip the ruptured aneurysm that was killing me, the voices provided instruction with impossible precision. They knew details about my brain anatomy that hadn't been visible on any imaging study. They predicted how tissues would respond to manipulation before I touched them. They seemed to have perfect knowledge of every blood vessel, every nerve pathway, every structural detail of my individual brain. Stop, the woman's voice commanded suddenly as I was positioning the titanium clip that would seal the aneurysm. Examine the vessel wall more carefully. There's a weakness you can't see yet. I paused and looked more closely at the aneurysm. To my conscious perception, everything appeared normal and ready for clipping. But as I examined the tissue under higher magnification, I discovered a microscopic tear in the vessel wall that would have caused catastrophic bleeding if I had proceeded. Reinforce the vessel with tissue glue before clipping, the younger voice instructed. Apply it in a counterclockwise spiral, starting from the proximal end. Use exactly 0.3 milliliters. I followed their guidance and successfully reinforced the weakened vessel before placing the clip. The repair was flawless, with no bleeding and no damage to surrounding brain tissue. Without the warning from the voices, I would have caused a rupture that would have killed me instantly. But the most disturbing moment came when I realized that I was watching myself perform surgery with a detachment that seemed impossible. It was as if I was simultaneously the surgeon and an observer, experiencing the operation from multiple perspectives at once. I could see my hands moving with inhuman precision, making decisions and adjustments that my conscious mind hadn't planned. The hemorrhage is more extensive than your imaging showed, the deep voice noted with clinical detachment. There are 3 additional bleeding points that need to be addressed. We'll guide you to each one. He was correct. As I explored the surgical site, I discovered multiple sources of bleeding that hadn't been visible on any of my preoperative scans. My brain hemorrhage was far more complex than anyone had realized, involving tears and vessels that conventional surgical approaches would have missed entirely. For the next hour, I operated on my own brain while guided by voices that demonstrated surgical knowledge beyond anything in medical literature. They knew things about neuroanatomy that I had never learned. They predicted complications with perfect accuracy. They provided solutions to problems that hadn't yet occurred. "There's going to be swelling in the temporal lobe when you finish the vascular repair," the woman's voice warned. "Administer 15 milligrams of mannitol now, before the swelling begins." I injected the medication as instructed, and the predicted swelling never developed. The voices seemed to know not just what was happening in my brain during the surgery, but what would happen in the hours following the procedure. As I began closing the surgical site, the voices started to fade. Their instructions became less frequent, their presence less distinct. By the time I was suturing my scalp, I could barely hear them, and their guidance was replaced by my own surgical knowledge and training. "The procedure is complete," the deep male voice said, his words now barely audible. "You will recover fully, but you must never speak of what happened here." "Why not?" I asked aloud, my voice echoing strangely in the operating room. But there was no response. The voices had vanished, leaving me alone with the realization of what I had just accomplished. I had successfully performed complex brain surgery on myself while conscious, guided by unknown voices that had provided surgical expertise beyond anything in medical training. Dr. Henderson and my surgical team had been monitoring the procedure through cameras and had documented everything that happened. When I emerged from the operating room 4 hours after beginning the surgery, my neurological symptoms had completely resolved. Emergency imaging showed that my brain hemorrhage had been perfectly repaired with no residual damage or complications. "Rachel, what you just did defies every principle of neurosurgery," Dr. Henderson told me as we reviewed the surgical footage. "No one operates on their own brain. The psychological stress alone should have been incapacitating, but somehow you performed some of the most complex neurosurgical techniques I've ever witnessed." But when we examined the surgical documentation, we discovered something that disturbed me more than the mysterious voices. The operative notes that had supposedly been dictated during my procedure were written in handwriting that I didn't recognize. The technical details and surgical techniques described in the notes included procedures that weren't part of my training and anatomical observations that exceeded what should have been visible during the operation. "Did you dictate these notes during the surgery?" Dr. Henderson asked, showing me the surgical records. I studied the handwriting carefully. It was precise, legible, and completely unfamiliar. The content was medically accurate and described exactly what had happened during my operation, but it was written in terminology and style that I had never used in my own documentation. "I don't remember dictating anything," I replied. "I was completely focused on the surgical procedure, and this definitely isn't my handwriting." We questioned everyone who had been present during the surgery, but no one remembered me dictating notes or anyone else writing documentation during the procedure. The surgical records had simply appeared in my patient file, written in an unknown hand but containing perfect details about every aspect of my operation. In the days following my surgery, I underwent extensive neurological testing to assess my recovery and try to understand what had happened. Every test came back completely normal. My brain function was perfect, my motor skills were intact, and there was no evidence that I had ever suffered a brain hemorrhage. It was as if the surgery had not only repaired the damage but had somehow enhanced my neurological capabilities. But I knew something fundamental had changed. During my first surgery after returning to work, I began experiencing moments of enhanced awareness that seemed to come from outside my normal consciousness. I could sense anatomical variations before seeing them, predict complications before they occurred, and perform techniques that I couldn't remember learning. "Dr. Torres, your surgical outcomes have improved dramatically since your incident," Dr. Henderson observed after reviewing my cases from the following weeks. "Your success rate was already excellent, but now it's statistically impossible. You're performing procedures that push the boundaries of what we thought was medically achievable." She was right. In the month following my own surgery, I performed several operations that should have been impossible given the complexity of the cases and the limitations of current surgical techniques. I saved patients who other neurosurgeons had declared inoperable. I repaired brain damage that medical textbooks said was irreversible. And in each case, I was guided by knowledge and abilities that seemed to come from somewhere beyond my own training and experience. The most traumatic case occurred 3 weeks after my own operation, When I was asked to remove a brain tumor that every other neurosurgeon in the hospital had deemed inoperable, the tumor was located in an area where any surgical intervention would cause permanent paralysis and cognitive damage. But as I studied the patient's imaging, I began hearing the familiar voices providing guidance about the surgical approach that didn't exist in any medical literature. Use a transventricular approach through the choroid plexus, the deep male voice instructed. Create a corridor 2.8 mm wide, angled 20 degrees toward the posterior aspect of the tumor. I followed their guidance and successfully removed the entire tumor through an approach that no neurosurgeon had ever attempted. The patient recovered completely with no neurological deficits. When I tried to publish the technique in medical journals, reviewers rejected the papers, claiming that the surgical approach I described was anatomically impossible and potentially dangerous. But the voices didn't just enhance my surgical abilities, they began making demands that made me increasingly uncomfortable. During procedures, they would suggest techniques that pushed the boundaries of medical ethics and patient safety. They wanted me to attempt experimental surgeries that could revolutionize neurosurgery but carried enormous risks for my patients. Remove the entire tumor bed, the woman's voice instructed during one particularly complex case. The approach will cause some cognitive damage, but it will guarantee complete removal of the cancer. For the first time since my own surgery, I refused to follow their guidance. The technique they were suggesting would save the patient's life but would destroy his ability to speak and process language. I couldn't justify causing that level of permanent damage, even to eliminate cancer. I won't do that, I said aloud in the operating room. The risks to cognitive function are too great. The response was immediate and terrifying. I felt intense pressure in my head, similar to what I had experienced during my own brain hemorrhage. My vision blurred, my hands began to shake, and I experienced pain that made it difficult to continue the operation. You will follow our guidance, the deep voice said, his tone now cold and threatening. You owe your abilities to us. You have no choice but to obey our instructions. I managed to complete the surgery using conventional techniques, removing as much of the tumor as safely possible without following the dangerous guidance from the voices. The patient survived with his cognitive function intact, though some cancer remained that would require additional treatment. But the confrontation with the voices left me shaken and afraid. I realized that whatever had saved my life and enhanced my surgical abilities was not entirely benevolent. The voices had their own agenda, and they were willing to threaten me to ensure my compliance with their increasingly dangerous instructions. That night, I made the decision that would end my career in neurosurgery. I could no longer practice medicine while being influenced by forces I didn't understand and couldn't control. The voices that had saved my life were also making it impossible for me to practice with the ethical standards that medicine demands. I submitted my resignation to Dr. Henderson the following morning, citing personal reasons and a desire to explore other career opportunities. I couldn't tell her the truth about the voices and their demands because I knew she would question my mental stability and fitness to practice medicine. Rachel, you're at the peak of your career, Dr. Henderson protested. Your surgical outcomes are unprecedented. You're revolutionizing neurosurgical techniques. Why would you walk away from all of that? I couldn't explain that I was walking away because my unprecedented outcomes were being guided by unknown voices that were becoming increasingly demanding and potentially dangerous. I couldn't tell her that I was afraid of what they might require me to do in future surgeries, or what would happen to my patients if I continued to follow their guidance. I've accomplished everything I wanted to in neurosurgery, I lied. It's time for me to try something different. During my final weeks at Mount Sinai, the voices were silent. It was as if they knew I was leaving and had withdrawn their guidance. I performed my last surgeries using only my own knowledge and training, and while the outcomes were good, they lacked the impossible precision and success rate I had achieved while guided by the mysterious voices. On my last day at the hospital, as I was cleaning out my office and saying goodbye to colleagues who had become like family during my 18 years there, I heard the deep male voice one final time. You're making a mistake, Dr. Torres, he said, his words echoing in my mind as I walked through the hospital corridors for the last time. We could have revolutionized neurosurgery together. We could have saved lives that no other surgeon could save. At what cost? I thought back. What did you really want from me? But there was no answer. The voice faded away, leaving me with questions that I may never be able to answer and abilities that I chose to abandon rather than risk the consequences of using them. I now work as a medical consultant, reviewing research data and safety protocols for pharmaceutical companies. It's meaningful work that allows me to contribute to medicine without making life-and-death surgical decisions while under the influence of forces I don't understand. I miss neurosurgery every day, but I know I made the right choice in walking away from the voices and their dangerous guidance. Sometimes, late at night when I'm reviewing medical studies, I still hear whispers of surgical knowledge that could transform brain surgery. I ignore them now, but part of me wonders what medical advances I might have achieved if I had continued to follow their guidance. Part of me wonders what lives I might have saved with their impossible knowledge, but I also wonder what they would have eventually demanded in return, and whether the cost of their guidance would have been worth the lives they helped me save. Some knowledge comes with a price that's too high to pay, and some abilities are too dangerous to use, even when they could benefit others. The case of my own brain surgery remains the most unexplained and transformative experience of my life. It taught me that consciousness and surgical knowledge might come from sources beyond our current understanding. It showed me that the line between medicine and the supernatural might be thinner than we realize. Most importantly, it taught me that some gifts are too dangerous to accept, even when they offer the promise of saving lives and advancing medical knowledge. The voices that saved my life and enhanced my surgical abilities may still be out there, waiting for another surgeon who is willing to accept their guidance and face the consequences of using knowledge that comes from unknown sources. For now, I've chosen the safer path of conventional medicine and traditional knowledge, but I'll always wonder whether I was a coward for walking away from abilities that could have revolutionized neurosurgery, or whether I was wise to recognize that some powers are too dangerous to wield, even in service of saving lives. The surgical scars on my scalp have healed completely, leaving only faint lines that are barely visible beneath my hair. But the memory of those voices, and the knowledge they possessed, will haunt me for the rest of my life. Because somewhere out there, unknown forces have access to medical knowledge that could transform human health and save countless lives. And they're waiting for someone brave enough, or foolish enough, to accept their guidance and pay whatever price they eventually demand in return.